Pain is something that it's like an alarm system of your body alerting you that something is not quite right. But sometimes you find people downplaying it and saying it is just normal period pain. Welcome to my channel. My name is Dr. Raisha, a pharmacist and a fertility and women's health expert. If you are new to this channel, please do not forget to subscribe and hit the notification bell down below. So today we are going to be looking at endometriosis. Endometriosis is a monster. Endometriosis is a disease that is affecting millions and millions of women worldwide. So I want you to look at this diagram here. This is the female reproductive organ. It might not look like it, but please, I spent 2 hours drawing this. Please bear with me. So this here is the ovary. This is the uterus. And this, yes, these are the fallopian tubes. And so we have a lining here that we call the endometrial lining, a lining that is lining the uterine wall. And so when this endometrial lining goes and implants itself in another organ outside the uterus, that is what we call endometriosis. Most of the time, the endometrial lining implants itself in other organs inside the pelvic region. And some of these organs could be the ovaries, the rectum, the bladder. But also, in some very rare cases, we find it implanting itself in organs outside the pelvic region, such as the small intestines, such as the abdomen, abdominal cavity, and also even the lungs. Today, we are going to look at some of the signs and symptoms associated with endometriosis. The main sign that people living with endometriosis experience is pain. Pain is something that it's like an alarm system of your body alerting you that something is not quite right. But sometimes you find people downplaying it and saying it is just normal period pain. And pain in endometriosis can manifest in different ways, whereby you find that this person can experience very painful menstrual periods, something that we call dysmenorrhea. And you can find that this pain is extending even after the menstrual periods have ended. Again, these people experience pain during sexual intercourse. You can get somebody telling you that they usually feel a lot of pain during sexual intercourse and they usually have very painful periods. Then you can think about endometriosis. Again, these people could experience pain during urination, something that we call dysuria. Again, somebody could experience pain during defecation, something that we call proctitis. Again, this person could also be experiencing chronic pelvic pain. This is whereby they have chronic. Chronic means never ending pain that is always there or keeps coming back in their pelvic region. Again, when these people experience their period, most of the times, they receive very heavy bleeding. You see that endometriosis is usually associated with very heavy bleeding. Again, intermenstrual periods. This is whereby maybe after 2 weeks of your period, you just get another period. After 1 week, you start bleeding again. That is what we call intermenstrual bleeding. Endometriosis is also associated with depression. Imagine somebody living with this kind of pain. You are stressed most of the times due to the low quality of life that you have, and this could lead to depression, anxiety. Maybe you keep anticipating, maybe today I'm not feeling pain, but tomorrow I could be in serious pain, and so this person lives in great anxiety. Again, endometriosis could be associated with signs such as nausea, such as abdominal bloating. And now, let us look at what are some of the causes of endometriosis. So, in this, you will see some of the things that even may seem abnormal to you. when we are discussing the causes of endometriosis. Cause number one, let us talk about retrograde menstruation. What does this mean? This means the backflow of blood. And somebody will ask me, how is that even possible? How can blood flow back? You know that after now the uterine lining are shed, blood is supposed to go this way through the cervix and through the vagina. Now, I'm talking to you about a situation where now blood flows back. Is that even possible? Blood is flowing back like this. That is what we call retrograde menstruation. And this can occur maybe due to a very small cervix. You see, if you learn physics, you learn about pressure. And so if the hole is so small, you see, so some will be passing through, but some will be being pushed back. And that is where we see retrograde. Okay, and also it could be due to genetics. And I want you to note that now this blood is the endometrium lining that has shed. So this blood contains the endometrium lining cells. Okay, and so when it goes back, maybe all the way to the ovary, these cells could now start growing and implanting themselves in the ovary. And that is one cause of endometriosis. Another cause is cellular metaplasia. What do I mean by that? Cellular metaplasia is whereby cells change from one type to another. Maybe the rectal cells, the cells in the rectum, they change their form and become endometrial cells. Yes, it is very possible for that to happen, whereby I have cells X changing their form maybe to Y. And so you find maybe the cells in the ovary, they could change. Something like the way cancer happens, we say that maybe normal cells, they change their form and become cancerous. So these cells, maybe of the ovary, they undergo something we call metaplasia. They change their form and become endometrial cells. Another cause of endometriosis could also be due to prolonged exposure to estrogen. When this person maybe has been exposed to estrogen, maybe for long periods of time, maybe even due to a hormonal method that contains estrogen, this could, because I want you to note that estrogen is the hormone that facilitates the growing of the endometrial lining, and estrogen is also responsible for the pain that this person feels during endometriosis. Another cause is stem cell migration. What is that? Stem cell migration is when now the cells move from one place to the other. So the endometrial cells here move all the way to the ovary, move all the way to the bladder, move all the way to the rectum and implant themselves there. And so those are some of the causes of endometriosis. And now, how do we treat endometriosis? I want to tell you that endometriosis has no definite cure. And what we do is try to improve the symptoms to alleviate the pain that this patient may be experiencing. And so some of the treatment options that are used are painkillers such as NSAIDs. NSAIDs are drugs such as brufen, diclofenac, mefenamic acid, ketoprofen. And these drugs have not been really found to be effective, but in some patients, they help alleviate the pain. Another treatment option is hormonal drugs, such as the pill, the implants. These drugs do what we call ovarian suppression. And so we find that most patients are advised to take the pill for 3 to 4 months without taking the red menstrual placebo tabs that are usually found at the bottom. And so you find that this patient does not receive their menses and hence there is no pain that is associated with it. Another thing is surgery. These patients may undergo surgery to remove the endometrial lesions and also to remove the scars, the lesions, and the adhesions. Again, they can also undergo a more non-invasive procedure that we call laparoscopy. I want you to note that the oral contraceptive pills, the implants, and those family planning methods are given to women who are not looking to conceive. For a woman looking to conceive, we can give them fertility drugs to assist in conception. And there you have it, guys. I hope you have understood endometriosis, the causes, and how we can treat it. If you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, please do not forget to subscribe.